the recent year, a series of vector-borne diseases have spread to new geographical area across the world, of which several are caused by hemoparasites. These parasites will present in the blood. Haemoprotozoan occur in the genera Anaplasma, Babesia, Ehrlichia, Thylaria, and Trypanosoma. These may cause challenging and devastating conditions with a severe impact on the small ruminant industry. As the poor farmer, they depend on the small ruminants for their livelihood. The distribution of these infection changes continuously due to the migration and transportation of vector and animal. As the animal will transport, the vector will also transport with the same. An increased globalization of both live animal and their product, short and long distance movement of vector and host. As the animal will travel or transport, whether it is long distance or short distance, the vector will also move with the host. These changes will have a huge effect on the distribution and establishment of both pathogen and vector. Around 900 species of tick have been described, but out of that, Iodes, Hemophysalis, Hyloma, Rhipicephalus, and frequently associated with the small ruminants. And these are basically transmit the disease, that is Babesia, Thylaria, and Anaplasma. But in case of trypanosomes, such as biting flies in the genera Tabanus, Stomoxis are the important mechanical vector in Asia. In Trypanosoma, there is a biting flies. And the globally, tick and tick-borne disease are the major constraint on a profitable livestock production and productivity. Tick-borne disease, obviously, it will affect the animal health, so meat and milk all will disturb. Haemoprotozoan disease, especially Perbasiosis, Anaplasmostis, Thylariosis, and Trypanosomiasis, are considered as a major impediment to the health and productive performance. It's an obvious if the animal will suffer from the tick-borne diseases, TTBD, so the productive performance will be less, and the health and the weight gain of the animal will be very slow. Disease in sheep and goat result in the mortality and morbidity losses, resulting in the low productivity of the animal. So there will be number of chances for the morbidity, and if animal is untreated, then mortality will occur. The major loss in the meat industry as well as milk industry. The effect of a disease on a herd can be modeled by increased death rate. There will be increased death rate, lower milk yield, there will be decreased body weight, there will be increased skidding interval, so there will be loss to the farmers. Vector of livestock are having economic significance on the 3 points. Number one is direct loss from their bite, and it will create the annoyance and worries. Psychological disturbance is due to the act of biting and the feeding and the disease they transmit. And the third one is expenditure incurred for their control. These are the major economic significance of these. For control of vector, the recent concept of integrated pest management, that is IPM, provide the best solution and also address the problem related to acaricide resistance and environmental protection from the hazardous chemicals. Now, IPM is an inspection, identification, prevention, and treatment. If we will follow all the things, if we follow IPM, it will be easy to control the vectors. Now, coming to acaricide resistance, as again and again, if you will use the same chemical, then the tick will be resistant for that. And the same thing we will use for the another animal, then maybe it will be react. So we should not use the same acaricide, we should change. Haemoprotozoan diseases in sheep and goat are Thylariosis, Babesiosis, Trypanosomiasis, and Anaplasmosis. These are the major diseases, but these are the neglected in case of sheep and goat. In case of Thylariosis, here you can see the coach blue bodies in the slide. Thylariosis is a tick-borne protozoan disease characterized by enlargement of lymph nodes and high fever. The causative agents are Thylaria hirki and Thylaria ovis. Thylaria ovis will cause the mild thylariosis. And the vector are Rhipicephalus species, Hyloma species, and Hemophysalis species. Here you can see in this picture the Difficipalus tick, and the image of Haemoprotozoan species. There is a basic difference in the leg of the ticks. Now coming to the pathogenesis, the tick inoculation of sporozoites and lymphocytes in the local lymph nodes. There will be schizogony and lymphoid proliferation, and after that parasitemia more develop in the lymphoid proliferation, and it will develop to merozoites, and then it will come to erythrocytes, then pyroplasm will be developed, and finally in the ticks. The damage is mainly caused by the schizones. Now here you can see the life cycle of the Thylaria species. In case of vertebrate, there will be development of the schizones in the lymphoblast, and there will be clonal expansion. Then schizones will develop to merogony, and then merozoites develop, and in the erythrocytes, the pyroplasm will be developed. In case of nymph stage, the schizogony occur and zygote form in gut lumen. The kinate form in gut epithelial cell, which will lead to molting. But in case of adult stage, there will be, in case of ticks, in salivary gland, there will be sporogony occur forming sporozoites, which will lead to sporozoites transmit through saliva and hence infecting the animal. Now coming to the clinical sign, there will be first sign, that is fever, 40.5 to 41.5 degrees Celsius, that is 104 to 105 degree Fahrenheit. Lacrimation and corneal opacity will also develop, and there will be enlargement of superficial lymph node, which can be palpable. Now, there will be generalized lymphadenopathy. There will be adhesions of the lymph nodes, and there is marked anemia. There will be icterus of conjunctiva with petechial hemorrhages, and there will be sign of jaundice. Here you can see in the picture, there is a pinpoint hemorrhages and enlargement of the lymph node. At the time of necropsy, we will find splenic enlargement, that is splenomegaly, and generalized lymphoid hyperplasia, and small lymphoid nodules present in the liver, kidney, and alimentary tract, and there will be severe pulmonary emphysema. Now you can see in this image, there is a splenomegaly, and there is a characteristic punched out ulcer in the abomasum. Diagnosis will be done on the basis of history and the clinical sign, and the history, like the history of ticks and high rise of temperature, and clinical sign like inflammation of the lymph nodes. After Giemsa stain blood smear, there will be pyriform shaped pyroplasm in the RBC, which will be helpful for the identification of the Thylariosis. Lymph node biopsy and impression smear, we will found coach blue bodies in the lymphocyte. In lymph node biopsy, we will found coach blue bodies in lymphocytes. Now here you can see in this picture the merozoites inside the RBC of infected animal, and macrocyzones of Thylaria ovis in lymphocytes. You can see the both in this image. Now coming to the serological test, immunofluorescent antibody test, which is most widely used, can be done. Complement fixation test can be done, and indirect hemagglutination test can be done, and ELISA can be done. Now coming to the differential diagnosis will be done with anaplasma and Perbasiosis. Because of anemia, this disease can easily be differentiated from Thylariosis on the basis of blood smear, that there will be, in case of Thylaria, there will be coach blue bodies. From Trypanosomiasis, there will be anemia, edema, and lymphadenopathy. And the blood and lymph node smear examination will normally differentiate between the two diseases. Coming to the treatment, Parvacone is a specific drug for the Thylariosis. It should be given at the rate of 2.5 mg per kg body weight intramuscularly and repeated after 48 hours if required. And the injection oxytetracycline should be given long-acting at the rate of 20 mg per kg body weight intravenously with normal saline. Along with vitamin B complex should be given at the rate of 3 ml intramuscular for 3 days daily. Now coming to the control, integrated approach involving resistant animal breed. There should be regular use of acaricide in the animal house and on the animal. Prolonged use of same acaricide should be avoided to prevent the development of resistance. The tick density and population can be reduced by using acaricides such as malathion or sumithion, that is 0.5 to 1% in the spray form. Deltamethrin should be given 2 ml per liter of the water. Pestoban, it is a herbal liquid. It should be diluted 10 times and sprayed. For control of ticks, ivermectin can also be given at the rate of 1 ml per 50 kg of body weight subcutaneously. Now, the another disease is Perbasiosis. As it is already known, it is a tick-borne disease. Here you can see in this picture, there is a tick infestation in the ear, and the pale mucous membrane can also be seen. Perbasiosis is caused by intraerythrocytic obligate protozoan parasite and cause pancytopenia. That is, there will be deficiency of RBC, WBC, and platelets. Infection is initiated by inoculation of sporozoites in the bloodstream during the taking of blood meal. When the tick will be bite, then the infection will spread. Now coming to the transmission, here you can see in this picture, tick is Rifficephalus bursa, which will spread the disease. The agent are Babesia ovis, Babesia motasi in case of sheep and goat. It is transmitted by Rifficephalus bursa and Haemophilus species of tick. Now, coming to the life cycle and pathogenesis of Perbasiosis in sheep and goat. In this case, in case of vertebrate host, there will be active sporoblast, which will release the sporozoites, and the sporozoites, trophozoites, merozoites, and gametocytes is totally, it will call the merogony. The gamete fertilized to form zygote, and it will call the gamogony. In case of transovarial transmission, as the zygote undergoes meiosis, the kinase forms and lead to infection in the ovaries and thus help in spreading the infection. In case of transstadial transmission, zygote will develop to meiosis and there will be kinase formation and the multiplication of the kinase in tick tissue forming dormant sporoblast, which will be active sporoblast, and sporozoites will be develop and spread the infection. Now, coming to the clinical symptoms, there will be fever, anorexia, depression, weakness, anemia. There will be cessation of rumination. Lacrimation can also be seen, and hemoglobinuria. If animal will anorectic, then animal will not eat, then there will be loss of production and the animal will become weak. The main clinical symptom is hemoglobinuria, that is the coffee colored urine can be seen. Here you can see in this image also. In case of acute stage, there will be severe anemia, hemoglobinuria, jaundice. There will be dark red to brown color urine, abortion in the pregnant animal, and death in untreated ones. As in the small ruminants, the disease is unnoticed. In that cases, there will be death. And abortion in the pregnant animal, it is a spontaneous abortion. Now coming to the chronic cases, there will be extend from the several weeks with intermittent temperature. If the animal survives, it will show loss of weight, decrease in milk production, diarrhea followed by constipation, and progressive loss of body condition. So in the chronic condition, what will happen? There will be loss of weight. Diarrhea will followed by constipation, and there will be decrease in the production of milk. Body condition will be loss. Diagnosis will be based on the history and the clinical sign, as the history of ticks and the clinical sign like hemoglobinuria, anorexia, etc. And the presence of heavy infestation of tick. Here you can see in the picture pyroplasm in the RBC. In the blood smear, detection of pyroplasm intraerythrocytic in peripheral blood smear, which is not always possible. Both thick and thin blood smear may be used for the demonstration of the organism in the RBC. Coming to the serological test, indirect fluorescent antibody test can be done, ELISA can be done, complement fixation test can be done, indirect heme agglutination test can be done, and cart agglutination test will be done for the diagnosis. Differential diagnosis will be done with Thylariosis, that there will be no hemoglobinuria, but in case of Perbasiosis, there is hemoglobinuria. Differential diagnosis will be done with leptospirosis. In leptospirosis, there will be, it is severe in young ones, and there will be abortion in the pregnant animal, and stillbirth condition will be there in case of leptospirosis. Differential diagnosis will be done with anaplasmosis in trypanosomiasis, as the symptoms are almost same. But in case of bacillary hemoglobinuria, as the bacillary hemoglobinuria can be caused by the Clostridium novii type D, so it will be easy for the differentiate from these disease. Now coming to the treatment, immunocarb dipropionate should be given at the rate of 1 to 2 mg per kg body weight subcutaneously, and 2 mg per kg can also be given for prophylactic for completely eliminate the parasite with some residual activity. Now, another drug is diimidazine aceturate, which is coming in the name of Benadryl. It should be given at the rate of 3.5 mg per kg body weight, deep intramuscular, 2 dose at 48-hour interval. Next is OTC can be given at the rate of 10 mg per kg body weight once daily for 5 days. Along with the supportive therapy, which should be given, parenteral administration of hematinics like coffee cube, injection interferon, it should be given 1 ml per 45 kg of the body weight. We can also give vitamin B complex like Tribivet, Polybion, and the additional vitamin B12 supplementation can also be given. We can also give Belamil also, and non-steroidal anti-inflammatory drugs should be given, and polyionic isotonic fluid to rehydrate the animal. For example, 0.9% of NaCl and 0.5% of dextrose can be given, and antihistaminic should also be given. The control of Perbasiosis depend upon the control of tick population, and that is very tough task to control the tick. Control of tick population, acaricides have long been applied by the farmer around the world to reduce the deleterious impact of tick and tick-borne diseases on health and productivity of domestic ruminants, but the effect will be very less. For control of vector tick, knowledge of life history of the tick is essential. The tick which parasitize only one host are easier to eradicate and cause less spread of the disease which parasitize 2 or 3 host tick. The one host and 2 hosts, the difference is in a one host, the tick will require only one host to complete the life cycle. But in case of 2 or 3 hosts, the tick will require 2 to 3 hosts for the completing their life cycle. Rotational grazing, better feeding and the management condition and hygienic measures should be adopted to reduce the incidence of Perbasiosis. Feeding should be better and the management and hygienic conditions should be maintained properly to reduce the chances of Perbasiosis. Now, the third important disease is Trypanosomiasis. Trypanosomiasis, it is an infectious disease characterized by high rise of temperature. There will be wasting and anemia. Trypanosomes are flagellates, parasites that live in the blood and body fluid of their host. These are the flagellate parasites that live in the blood and body fluid of the host. Trypanosoma evansi is a hemoflagellate extracellular protozoan parasite cause a disease known as trypanosomiasis. It is a hemoflagellate extracellular protozoan parasite which is causing trypanosomiasis. In the image, you can see the hemoflagellate trypanosoma. Agent are Trypanosoma evansi, and the transmission occur transmitted cyclically by the flies belonging to the genus Glossina. Acyclically by hematophagous flies, the most important of which belong to the family Tabanidae and Stomoxy. Here in this picture, you can see the Tabanid flies, Stomoxys species, and Glossina species. These are the flies which spread the trypanosomiasis. Now coming to the life cycle of Trypanosoma evansi. In case of Trypanosoma evansi, in case of mammal, metacyclic form are injected into the skin of the host, multiply, and migrate via lymph to the blood. In bloodstream form, it will multiply by binary fission and undergo antigenic variation. In bloodstream, these form are taken up to the CC fly procyclic form, multiply in the gut. And then epimastigote form multiply in proboscis of CC fly and metacyclic will form, which will infect the animal. Now coming to the clinical sign, there will be diarrhea, as you can see in this picture, intermittent fever, there will be rapid pulse, dullness, bilateral lacrimation, and progressive emaciation. You can see in this picture there is a bilateral lacrimation and progressive emaciation. Now, coming to the diagnosis, there will be history of prevalence of Trypanosomiasis evansi infection and biting flies like tabanids or nearby the stable. And diagnosis will be done on the basis of clinical sign, that will be anemia, emaciation, and diagnosis will be done with the direct method and serological method. Wet blood film, in which direct blood can be seen under microscope for the hemoflagellates. We can stain the thick smear and there will be lymph node biopsy for the identification of hemoflagellate. Now coming to the serological test, ELISA can be done, cart agglutination test can be done, and latest agglutination test can be done. In this case, for the diagnosis, we can also do animal inoculation test. For detection of latent infection of animal, inoculation is more reliable than microscopic examination. For detection of latent infection, animal inoculation is more reliable. Now, differential diagnosis. Differential diagnosis can be done with anthrax, snake bite, nervous form of ketosis, organic and inorganic poisoning, milk fever, and brain tumor or cyst. In case of anthrax, there is sudden death of the animal and the blood will oozes out from the natural orifice. In case of snake bite, there will be the fang marks. In case of nervine ketosis, as the animal will move in a one direction, in case of trypanosomiasis, so it will differentiate it from the nervous form of ketosis. In case of organic and inorganic poisoning, there will be the nervous sign, so it should be differentiated from the trypanosomiasis. And in case of fever, milk fever, there is S-shaped posture in the stage 2, so it can also easily differentiated from the trypanosomiasis. And in case of brain tumor and cyst, also there will be the nervous form, which can be easily differentiated. Now coming to the treatment, diimidazine aceturate is preferred at the dose of 3.5 to 7 mg per kg body weight by intramuscular injection. If the treatment is ineffective, the use of imidocarb is recommended at the dose of 0.5 mg per kg body weight, and the withdrawal period for meat should be more than the 90 days. And another drug should be given melarsomin hydrochloride. This is a drug for heartworm diseases. It should also given to the trypanosomiasis at the rate of 0.5 to 0.75 mg per kg body weight. Chemoprophylactic drugs such as quinapyramine sulfate and chloride should be given at the rate of 8 mg per kg body weight, whereas quinapyramine sulfate should be given as chemotherapeutic, and for prophylactic, quinapyramine chloride should be given. Now coming to the prevention and control, because of abundance of biting flies, it is quite difficult to control Sura by measures directed against the vector. Some drugs can prevent trypanosomiasis are called prophylactic drugs. These are very effective in protecting animal during the time they are exposed to disease. In the housed animal, fly repellent measure like provision of wire mesh door and windows should be used, and fly repellent measures should be taken, just like we can spray fly repellent, and we can also use herbal products like neem leaves or the cow dung cake. Use of fly repellent chemical like carbolic acid and phenol should be used in the shed. Use of insecticide on the host can be adopted, in particularly in the hot and humid weather. Coming to the anaplasmostis, it is a tick-borne disease caused by Anaplasma ovis, characterized by fever, weakness, anemia, emaciation, and jaundice. The infection is frequently subclinical. but can also cause disease, which is more severe among the goats than sheep, particularly in stressed or debilitated animals, which have the weak immunity. The causative agent is Anaplasma ovis, which is a specific obligate intracellular parasite. The source of infection are only infected tick through tick like Buphalus hyaloma, Azodus, Ricicephalus species are involved. Now coming to the transmission, anaplasmosis is typically transmitted by ticks or biting flies, mechanical transmission by biting flies or blood contaminated fomites, and biologically by tick through transstadial transmission. Mechanical transmission will be done by the biting flies or blood contaminated fomites, and biologically by tick, that is through transstadial transmission, stage to stage. Iatrogenic transmission can occur when the instruments are reused, means while treatment, if the instruments are reused, so there will be transmission, iatrogenic transmission. If we have to reuse the instrument, we should properly sanitize that instrument as instrument used for dehorning, ear tagging, castration, and vaccination. We should properly sanitize it. In utero transmission has been reported. Coming to the clinical sign, there is a severe anemia. Here you can see in this image, there is the failure of mucous membrane. There will be high rise of temperature. There will be constipation or diarrhea. There will be pale mucous membrane and icterus sign can be seen. There will be hyperexcitability and animal may bite inanimate object. The field diagnosis will be done on the basis of history, clinical sign, lesion, and tick movement in area. Here you can see in this image, there is Anaplasma ovis identified on blood smear stain with Giemsa. In case of serological test, complement fixation test can be done. Capillary tube agglutination test can be done. On hematological finding, there will be decreased erythrocytic count, there will be decreased hematocrit, and there will be decreased hemoglobin concentration. Now coming to the differential diagnosis, from the Perbasiosis, clinically much more acute, and there will be hemoglobinuria, which is not present here. The differential diagnosis can be done with Hilariosis. Causative organism can be differentiated in blood smear. Cytones are seen in the lymph node biopsy along with enlarged lymph node, which is not present in anaplasmosis. Now coming to the treatment, tetracyclines are giving the good result in case of anaplasmosis. OTC should be given at the rate of 5 to 10 mg per kg body weight, single dose daily. It would be effective in elimination of carrier. Long-acting tetracycline should be given 20 mg per kg body weight intravenously every week for 2 injections. Immunocarb should be given at the rate of 3 mg per kg body weight. It is effective for classic cases. Amicarbolide, it is an anti-pyroplasmic drug. It should be given 20 mg per kg body weight with the subcut route. Now coming to the prevention, the eradication of anaplasmosis is not practiced in the most of the countries at present time due to the wide range of vector, long period of infectivity of carrier animal. So the eradication of the anaplasmosis is not practiced because there is a wide range of vector and long period of infective carrier animals. In some enzotic areas, some benefit is derived by the control of tick and other control of the vector. And the care should be taken to prevent artificial transmission by instrument used for injection or surgical operation. We should prevent the artificial transmission by instrument used for injection or surgical operation. It should be sanitized before using to the next animal. Limiting introduction to the animal less than 2 years of age and by bringing them in when the insect population is minimal. We can control anaplasmosis when the insect population will be minimal. Small animals should not be entered in the shed. Vigorous treatment of the affected animal and in contact animal should be put to a daily intake of 1 to 2 mg per kg body weight of oxytetracycline for at least 10 days. Vigorous treatment should be done of affected animal and in contact animal should be put to a daily intake of 1 to 2 mg per kg body weight of OTC around for 10 days. Now coming to the comparative chart of all 4 Haemoprotozoan disease, these are Perbasiosis, Thylariosis, Anaplasmosis and Trypanosomiasis. The organism name in case of Perbasiosis is Babesia ovis or Babesia motasi. But in case of Thylariosis, there is Thylaria hicki and Thylaria ovis. In case of Anaplasmosis, the organism name is Anaplasma ovis. But in case of Trypanosomiasis, the causative organism is Trypanosoma evansi. The disease is transmitted through tick in case of Babesia, that is Rhiphicephalus and Hemophysalis species. In case of Thylaria, Hyloma and Rhiphicephalus species transmit the disease. In case of Anaplasmosis, Hyloma and Buphyllus species transmit the disease. But in case of Trypanosomiasis, CC fly, blood-sucking flies, example Tabanus and Stomopsis, these are transmitting the disease. In rest all three, there is a tick transmit the disease, but in case of Trypanosomiasis, there is flies like Tabanus and Stomopsis, which are spreading the disease. Route of infection in all three are tick infestation, but in case of Trypanosomiasis, there is biting flies, which spread the disease. And the age-wise susceptibility in Perbasiosis, adult animal, but in case of Thylariosis, there is young animal. In case of Anaplasmosis, there is animal involved that is 6 months to 2 years of age. But in case of Trypanosomiasis, there is young animal which are susceptible to the disease. In case of Perbasiosis, there is a inverse age resistance. In that case, adult animal are more susceptible for the disease as compared to young ones. Now coming to the symptoms, in case of Perbasiosis, there is fever, anorexia, fast and audible heartbeat. There will be pale mucous membrane, icterus, there will be hemoglobinuria, abortion and emaciation. But in case of Thylariosis, there will be lymphadenopathy and there will be respiratory sign can be seen, anemia, fever, diarrhea and anorexia can also be seen. But in case of Anaplasmosis, there will be the pallor of the mucous membrane, anemia, jaundice, respiratory distress, ruminal stasis, abortion, and edema of submandibular region can also be seen. But in case of Trypanosomiasis, there will be diarrhea, intermittent fever, enlarged lymph node, rapid pulse, lacrimation, and progressive emaciation can be seen. The basic important for the Perbasiosis is hemoglobinuria, and for the Thylariosis is inflammation of the lymph node and lymphadenopathy. In case of Anaplasmosis, there will be the edema of the submandibular region, and in the trips there is intermittent fever along with enlarged lymph nodes. For lesions, now coming to the liver, in case of Perbasiosis there is necrosis, but in case of Trypanosomiasis, there is congestion and hepatomegaly. But in case of Thylariosis, there will be enlarged liver and pseudo-infarction in liver can be seen. In case of Anaplasmosis, there is yellowish color liver. In case of spleen, there will be splenomegaly, but there will be soft and splenic pulp. Soft and splenic pulp can be seen. In Trypanosomiasis, there will be enlarged dark red splenomegaly. And in case of Thylariosis, there is small and large hemorrhages. Small and large hemorrhages can be seen along with splenomegaly. And in the case of Anaplasmosis, there is splenomegaly. But the splenomegaly is the common, but in case of Perbasiosis, there is soft splenic pulp. But in case of Trypanosomiasis, there is enlarged dark red color of spleen. But in case of Thylariosis, there is the pinpoint large and small hemorrhages. Now coming to the heart. In case of Perbasiosis, there will be congestion of the blood. But in case of Trypanosomiasis, there will be hydropericardium and gelatinous fatty degeneration can be seen in case of heart. But in Thylariosis, there will be congestion in the heart. But in case of Anaplasmosis, there will be no lesion should be seen in the heart. In case of kidney, in case of Perbasiosis, there will be enlarged and congestion. But in case of trypanosomiasis, there will be gelatinous fatty degeneration. In case of Thylariosis, there will be congestion and petechial hemorrhages in the kidney. There will be congestion and petechial hemorrhages. But in case of anaplasmosis, there will be nephrosis. Coming to the lungs, in case of Perbasiosis, there will be congestion. In case of trypanosomiasis, there will be hydrothorax. But in case of Thylariosis, there is pulmonary edema and hyperemic lung can be seen. In case of anaplasmosis, there will be pale and edematous fluid can be seen. In case of urinary bladder, in Perbasiosis, urinary bladder will contain dark color urine. But in case of atrips, Thylariosis and anaplasmosis, there will be no lesion in the urinary bladder. In case of gallbladder, in case of Perbasiosis, gallbladder is distended with the thick and dark bile. But in case of trypanosomiasis, we will not find any lesion in the gallbladder. In case of Thylariosis, there will be distended with thick bile. But in case of anaplasmosis, there will be yellowish green bile present in the gallbladder. But in case of trypanosomiasis, there will be no lesion in the gallbladder. In case of body cavity, we will not see any changes in the Perbasiosis, but in case of trypanosomiasis, there will be ascites, petechial and ecchymotic hemorrhages on the serous surface of the body cavity. And same in the Thylariosis, we will not find any lesion in the body cavity, but in case of anaplasmosis, there will be anasarca, and presence of straw color fluid in body cavity. There will be anasarca and the presence of straw colored fluid in body cavity. But in case of Perbasiosis and Thylariosis, we will not found any lesion in the body cavity. Carcass appearance. In case of Perbasiosis, there will be ectric and emaciated carcass. There will be ectric and emaciated carcass. But in case of trypanosomiasis, there is pale muscular atrophy and dehydrated carcass. There will be dehydrated carcass. In case of Thylariosis, there will be ectric carcass with accumulation of the serous fluid. And in anaplasmosis, there is emaciated, pale, and ectric carcass. Coming to the blood, in case of Perbasiosis, there is a thin and watery blood. In case of blood, there will be thin and watery blood, but in other cases, in trypanosomiasis or Thylariosis or anaplasmosis, we will not found any lesion or any changes in the blood. Now, general control measures of Haemoprotozoan parasite in livestock. Keeping newborn stock away from the older stock. We should not mix the newborn stock from the older stock. Neither infection will spread from the older to newborn ones. Adopting the good hygienic measures in and around the shed. We should clean the animal as well as good hygienic measures should also be done in and around the shed. And we should properly control the vector or the flies, and chemotherapy should be done by using the different or specific drug against the disease. And the chemoprophylaxis can also be done by using the prophylactic drug. Example, chlorpyrimidium chloride, sulfonamide, and oxytetracycline, so that infection should not be spread. Now, chemoimmunoprophylaxis, it is an infection treatment method should be done. In case of immunization, vaccines are not available against this disease. Point to be noted, vaccines are not available against this disease. In case of Thylariosis, there is a vaccine developed, Rakshavec-T, but it should be used against the cattle, not in the ruminants. And the next point is arrangement of the quarantine system should be done. As the new animal or new flocks is coming, it should not be mixed in the older with the older animal shed. It should be kept for the 30 days in the quarantine. Now coming to the conclusion, for successful control of disease, epidemiological forecasting should be done And the quick and correct diagnosis should be done. For example, if we have found the animal suffering from disease or dull and depressed, emaciated, we should collect the blood and diagnose it. Safer and the quality vaccine should be developed because there is no vaccine developed. Sanitization measure along with adequate infrastructure facility for the cold storage. Sanitization measure should be done with adequate infrastructure. The major constraint in the control of disease in the developing country like India are no vaccination coverage. If the vaccination will be available, we can stop the spread of disease. There will be the lack of financial support and there is insufficient infrastructure. These interfere the building of the herd immunity. Now coming to the future perspective, animal disease are not only danger to the Indian economy, but also equally important in respect to the human health because sheep and goats are the food animals. So it is also important for the human health also. Door delivery of veterinary services and the better extension services for greater awareness to farmer will significantly enhance the possibility for eradication of disease, thus helping in control programs. This will help the to control this program for further.